and you'll hear that noise, and then you'll see a pop-up to confirm that you're okay with being recorded. Okay. Again, thank you everyone so much for being here on this Thursday evening for this conversation around community benefits and investments in our region. Before I proceed any further, I do want to make sure folks are aware that we have 2 languages available today, English and Spanish. To make sure we hear each other, it's important that you select the appropriate language channel. You can do that by looking for the circle at the bottom of your screen. It says interpretation, your 2 language options, English and Spanish. You'll select the one that you want to hear today. And I'm going to make sure everyone can do that and has done that before I move forward. Looking like everyone's good on that front. Cool. All right. So, Michael, could you bring up the slides, please? Okay. So welcome everyone again. This conversation is around understanding investments in our community's health. My name is Uju. I use they, them pronouns, and I am one of the co-directors of Oregon Health Equity Alliance, also known as OHE. And this is our 3rd advocacy workshop for this year. So let's keep it pushing. Zoom tutorial, because you can never go wrong with just orienting folks to Zoom. So let's go to the next slide. As I mentioned before, for interpretation, you'll look for the globe on the bottom of your screen and click the language that you want to hear today. We have English and Spanish. I've also dropped links to captions in Spanish and the presentation in Spanish in the chat box. And I will drop it again for folks who just joined. And we can go to the next slide. If you want to see all the panelists as well as the interpreters, we suggest making sure you hit the gallery view option. So if you look to the top of your screen, you should see like 3x3 squares, that icon, that's gallery view. So you'll click that so you can make sure that you see all the folks today. And then, so this is a webinar, so we won't be able to see or you won't be able to unmute yourself as well as an attendee. But if you have a question, please use the Q&A option, which is the icon titled Q&A. If you want to see who else is in the room, you can click participants. And then if you have any questions, concerns, please feel free to use the chat box. We do have folks who will be monitoring that throughout the session. And then if you want to ask a question, particularly during the Q&A section, you'll click the raise hand function, and then I can unmute you. So if you wanted to ask your question verbally, you can do that. Any questions on Zoom before we move forward? All righty. Okay. Next thing is the land and labor acknowledgement. So we are going to do a land and labor acknowledgement, and I will read off the screen. So every community owes its existence and strength to generations of ancestors who contributed to our hopes, dreams, and collective possibilities. Together, their history allows us to leave our own legacy of hope and justice. Our collective history is that of cultural resilience, re-indigenization, adaptability, colonization, settlement, systemic violence, racism, and forced displacement. Acknowledging this truth helps build mutual respect and connection across diverse communities and lived experiences. So for our land acknowledgement, we start by acknowledging that the land on which OHE is situated and which we occupy tonight, what we know as the Portland metro area, rests on traditional village sites of the Multnomah, Wasco, Cowlitz, Cathlamet, Clackamas, bands of Chinook, Tualatin, Kalapuya, Malala, and many other tribes who made their homes along the Columbia River, creating communities and summer encampments to harvest and use the plentiful natural resources of the area. We are on this land because of the forced removal of its traditional people by white colonists and settlers. We recognize the rights of Native and Indigenous people and nations have been and continue to be denied and violated. We want to thank the original caretakers of this land and their descendants who are still here. In addition to our thanks, we encourage folks to take action in supporting Native and Indigenous communities, such as learning more about the Indigenous people of the land they occupy, honoring treaty right obligations, creating deeper relationships, and supporting land-back initiatives to Native communities. And then we'll move to our labor acknowledgement. So we must acknowledge that much of what we know of this country today, including its culture, economic growth, and development throughout history and across time, has been made possible by the forced labor of enslaved Africans and their descendants, who suffered the horror of the transatlantic trafficking of their people, chattel slavery, Jim Crow, and repressive laws, including the Black exclusion laws in Oregon, that continue to impact Black folks today. We are indebted to their labor and their sacrifice. Moreover, we must acknowledge and address the tremors and legacy of that violence throughout the generations and the resulting impact that can still be felt and witnessed today in our region and beyond. And with that, we're going to take 30 seconds of silence. All right, next slide. You might be wondering, who is OHEA? Maybe you've been to one of our events before, maybe this is totally new to you. So we felt it would be important to say who we are. So OHEA is a people of color-led collaborative organized to center and uplift the wisdom of our communities of color through racial justice-informed health equity policies and practices as part of the movement to dismantle white supremacy and shift the imbalance of power. Our vision is that we envision a world where people of color are able to lead fulfilling and healthy lives however they choose. And we do this through 3 bodies of work: advocacy, so supporting racial justice, health equity policy and advocacy practices and policies. Convener, where we convene spaces like this between different partners, organizations, community members to learn more about what it means to do health equity work or live into health equity values. And then our knowledge center, which includes our training and technical assistance and curriculum around surprise health equity. So that is who OHEA is. And then goals for today, we're hoping to introduce and create connections between our communities and community benefit and investment partners. So thank you so much for folks, our partners who are able to be with us today. And then we're also hoping to create a space for OHEA members and the broader community to ask questions and learn more about community health and investment initiatives, structures, and practices, and how to influence them. So before I pass it over, just a reminder to please use the chat box and question function to let us know your needs or questions. Please say your name before speaking so we know who you are. An additional ask to be mindful of your pace while speaking and to articulate as much as possible for interpreters. And then this session will be recorded, which you already know, and to take care of yourself. And then just kind of run a show, I'm going to pass it over to Joni, who will be our facilitator for today. We'll have a brief discussion of what community benefits entails. We'll go into our panel, and then we'll do a Q&A, and then we'll close out. So I'm going to alley-oop it to Joni. Thank you, Joni.
Thank you, Yuju. Hi, everyone. Thank you all so much for being here. My name is Joni Tang, and my pronouns are they, she. I am a member of the community advisory team that was involved in Healthy Columbia Willamette Collaborative's 2022 Community Health Needs Assessment, or CHENA process. I am Asian with light olive skin, Black hair pinned into a bun, and wearing a Black blouse and large glasses with dark orange lenses. I'm honored that OHEA invited me to facilitate tonight's panel discussion. It's been really rewarding to work with Uju and Michael. Having worked on the community health needs assessment the past 1.5 to 2 years, I'm really invested in this work, and having the opportunity to continue this work and advocate for my communities is really important to me. Next slide, please. So, what are community benefits? Community benefits and investments is a sector that is all about direct investments into community identified needs. Organizations perform community health needs assessments, or CHENAs, to identify the needs of the community so resources can be directed towards addressing those needs. Different entities have different requirements to do some level of community investment. As general examples, hospitals have special nonprofit status and are required to invest a certain percentage of funds into community investments in health. They're required to perform CHINAs every 3 years, and based on its findings, must spend a certain percentage of their funds addressing the needs that CHINA identifies. Coordinated care organizations, or CCOs, must fulfill contract requirements from the state and conduct a CHINA every 5 years. Based on the findings from the CHINA, CCOs create and fund community improvement plans that also address the needs that CHINA identifies. Public health departments must conduct a CHINA every 3 years as part of their accreditation process. A community improvement plan that invests in community health based on the needs identified by the CHINA must be initiated by the public health department. So all of these different organizations must conduct community health needs assessments. And in order to avoid duplicating work and burdening the community by repeatedly extracting data from the same communities, several organizations partnered together and pooled their resources to conduct their CHINAs. This is where the Healthy Columbia Willamette Collaborative comes in. Now, the Healthy Columbia Willamette Collaborative, or HCWC, is a voluntary and unique partnership between 13 organizations in our Quad County region, which includes Clark, Washington, Clackamas, and Multnomah. That includes hospital systems, CCOs, and public health departments. So this basically means that CHINAs, or the data collection, is collaborative, but what each organization does with the data is independent. Now, some organizations may partner with one another for specific initiatives or projects to improve community health, but there are complexities that create natural barriers for coordinated implementation of plans. For example, each organization has different timelines, different leaders in their organizations, and different populations they serve and are accountable to. Some organizations are natural competitors in the healthcare marketplace. Each organization has also undergone transition and turnover, which can affect their program's historical knowledge. What the organization does with the CHINA can also differ. Some may use the CHINA as it was published and use it in its entirety, whereas others may use information from the assessment and supplement it. Also, community means different things to different organizations. For example, for CCOs, the population they serve are Medicaid patients. Hospitals serve regions. Public health departments serve their county community partners and the Public Health Advisory Council. Additionally, some organizations may have their own community advisory committees. If, for example, the CHINA were to identify 15 priorities, their community advisory committee may want to focus on the top 2 for their membership. So our panel discussion tonight is all about finding out more. As Uju introduced earlier, our goals tonight are to introduce and create connections between our communities and community benefit investment partners, inform OHAE members and the broader community about opportunities to lead or influence community investments from health systems, create a space for OHAE members and broader community to ask questions and learn more about community health and investment initiatives, structures, and practices. Next slide, please. So I have the pleasure of introducing our panelists tonight. Each panelist supports our community within the systems they work in. Tonight, they hail from Legacy Health, Oregon Health Authority, Health Share of Oregon, and Washington County Public Health. Thank you all so much for showing up and supporting this work. Panelists, please introduce yourselves in the order that's listed on the next slide, and please include your name, pronouns, role, organization, and a brief visual description. And Kamisha, if you could kick it off, that'd be great.
Great, thank you. Good evening, Kamisha Robinson, she, her pronouns. Legacy Health, I'm the Director of Community Benefit. And what's the next one to give a description about myself? I believe that's the next one. African-American woman, I live in Vancouver, Washington with my dog, Pepper.
Hi, good evening. My name is Dolly England, she, her queen. I am the Community Engagement Program Manager at the Oregon Health Authority's Public Health Division. I am a Black woman with glasses and curly hair. Kind of look like Beyonce.
Good afternoon, buenas tardes. My name is Marieta Foya. I use she, her, ella pronouns. I serve as the Director of Community Health at HealthShare of Oregon, and I am a brown-skinned Mexican woman with Black and some gray hairs with glasses.
Hi, everybody. My name's Alicia Lee. I use she, her pronouns, and I'm a senior program coordinator at Washington County Public Health, and I manage our county's community health improvement plan work. And I have olive skin and dark brown hair that is pulled back in a ponytail, and I am Middle Eastern American.
Thank you. Next, I think if you could skip to next slide. So our panelists were given 4 questions to prepare ahead of time. I'll read each question one by one, then give the floor to the panelists to answer. And if each panelist can keep their answer to 2 to 3 minutes for each question, this will give us time for a Q&A at the end. And just as a friendly reminder, please try to avoid the use of jargon and acronyms as much as possible. And please be sure to speak at a slower pace to give time for interpretation. So the first set of questions asked about their organization's community benefits and investments. So first, please provide a quick overview of your community benefits and investments, including the purpose and goals and regulations driving them. Kamisha, if you want to start off.
Sure. Well, first, thank you for inviting me to participate on the panel. I really appreciate the opportunity to share about community benefit and what it is for our health systems. I know some of this information that I've bulleted out for us will be kind of a review of what was already mentioned in the intro. We definitely have an opportunity to continue to share about what community benefit is and really what it isn't. I've been at Legacy a little over 4 years and remember when I was at Multnomah County Health Department, Public Health, working on our community health improvement plan before I came to Legacy. And our group was plotting and strategizing about how to obtain resources from hospitals, community benefit, and it was such a mystery, and it really shouldn't be. So that means that we as health systems need to continue to share about the work that we're doing, the breadth and depth of what it is. So for like regulations purpose, we define community benefit at both the state and the federal level. There are community benefits or programs or activities that provide treatment, promote health and healing, and address disparities and address social determinants of health in response to identified needs. In exchange for our tax-exempt status, which this wasn't mentioned, I think nonprofit hospitals are expected to invest in the health of their community, and we should do this anyways, and have been doing this pre-ACA. In 2010, the Affordable Care Act required hospitals, as mentioned before, to assess the needs of our communities through community health needs assessment, CHENAs for us, and accompanying implementation strategies, CHIPS, once every 3 years. Our last CHENA was just recently conducted, as mentioned, in 2022. And we do a separate CHENA for our Silverton Hospital, which is done in partnership with Mary and Polk Health Departments. Our most visible benefit to the community, as we're kind of talking about investments, is often seen as the cash and the unreimbursed care. But there are essentially 10 reportable community benefit categories, things we count, if you will, from our charity care, so our free or discounted health services for people who can't afford it, to the underpayment, which is the shortfall created when we receive payments that are less than the cost of caring for our patients. That are on Medicare or Medicaid. We also can count time for our leaders that sit on community boards. So just really sharing about that as we kind of lead into the purpose and goals is our community benefit portfolio is often thought about as just cash, and it's so much more. For us, our benefits to the community last year totaled $640 million. And then a number of the categories again make up our total community benefits.
That is super awesome work that's happening over at Legacy. I will give you a sliver of a perspective for what's happening at the state level. And again, I am with the Public Health Division. We are the community engagement team, and I'm going to tell you a very long story, very short. So COVID happened. We immediately knew that we needed help. There was no way we were going to be able to do contact tracing, provide wraparound support services for individuals that needed isolation and quarantine without the help and support of our community partners. And so Uju's going to drop a link for me. This first link is a link to our COVID-19 community engagement team. We're able to fund over 170 community-based organizations, totaling over $100 million to provide direct services around COVID-19. The other thing that we were able to do, because quickly we realized this was a good idea, people are receiving services well from our community partners, and we as the state really should be shifting power and resources back to community. And so the second link that I'll have Uju drop is actually our newest program, which is our public health equity funding. We have approximately 140 community-based organizations that we are currently funding around 8 different public health content areas. So we had adolescent and school health, HIV, commercial tobacco, climate, injury prevention, and a few other public health programs come together and say, let's pool our money and create a funding opportunity where community-based organizations can actually apply on
Sorry,
one
Dolly,
application.
you're going out a little bit. It's a little muffled.
Sorry about that. Can you hear me better?
I can.
Okay. So we gave money to over 140 community-based organizations to do those work. And it's because public health programs came together and said, let's go ahead and pool our funds to try to support community. We're looking at ongoing investments through that work. And you can check it out, all of the organizations that we funded through those links. So we've used like state, federal dollars to fund those programs.
I guess I go next. So our CCO, so we are a coordinated care organization and we operate a little bit different. I will share later with the OHAIC team a visual that really helps understand kind of the health share structure. We are 1 out of 16 CCOs in our state. And we definitely look a little different from the other 15 CCOs. Essentially who HealthShare is, even though we're the largest coordinated care organization, we serve over 400,000 Medicaid members in the Tri-County area. Here at HealthShare, the organization, there's only about 60 employees. And even though I just said we're the largest CCO, you're like, wait, only 60 people? That's not, how can that be possible? A lot of the partners in our plans are part of our collective. So you will hear that term being used when I talk about HealthShare, the collective. And what I mean by that is essentially we have 5 health plans that we delegate a lot of our work and a lot of the care that that we are responsible for providing for those 400,000 members. So for example, as part of our collective, Care Oregon, Kaiser, Providence, OHSU Health, Legacy Pacific Source, and I'm missing somebody. What am I missing? Legacy Pacific Source. So the 3, Providence, Kaiser, OHSU Health.
Did you say Care Oregon?
Care Oregon, yes, I have the 5. I'm like, wait, I didn't forget anybody. So all of those 5 plans, plus our county partners are also part of the collective. So Washington, Maloma, and Clackamas are part of the Health Share Collective. A lot of the benefits, or a lot of the, not the benefits, but the funds that we receive from the state, from Medicaid or Oregon Health Authority, are to provide the direct care, right? So providing the medical services, behavioral health, non-emergency medical transportation benefit, all of that. And so we don't have like a community benefit department like Kamisha, but our partners do have community benefit programs and initiatives. In the past, we have funded, for example, because of COVID, we did fund 5 million for community benefit funds that were used to support particular communities of color and community-based organizations that were serving those communities through the pandemic. Now, here's an interesting thing that I will share a little bit more throughout the conversation today, is that there are new regulations from the Oregon Health Authority in terms of how to invest and the need to invest in community-based or community investments in general. There is something called the SHARE initiative, which basically is allowing CCOs to invest any portion of profits back to community-based partners addressing social determinants of health. And HealthShare does plan to invest 20 million towards that SHARE initiative in 2023. And then there's a new Senate bill called 3353, which just passed, which also is requiring CCOs, so all 16 CCOs, to invest 3.3% of the global budget each year. And that is starting in 2024. So I'll share a little bit more of that as we continue this conversation.
Okay, I think I'm next. And again, I'm Alicia, joining from Washington County. So first I want to appreciate Joni's very helpful introduction. As Joni mentioned, Washington County is a local public health authority. And as such, we implement a Community Health Improvement Plan, or CHIP, and a Community Health Needs Assessment, or CHNA, as a requirement of our public health accreditation process. So we're required to do that, to go through that CHNA and CHIP process every 5 years, but we do it every 3 years to align with our hospital partners. And as was mentioned also in the introduction, the Healthy Columbia Willamette Collaborative is a regional community health needs assessment process that Washington County is one of the partners within and participates in. So we're just completing that CHNA process this year, and that will then inform the development of our next CHIP cycle, which we'll engage in over the planning year of 2023 to then implement starting in 2024. So our CHIP is a community plan for action that defines how we, Washington County Health and Human Services, and our community partners come together to improve health equity and address priority health issues. And we see this very much as a community partner-led plan. We provide the backbone support to implement the strategies and goals and objectives that our community partners identify as being a top priority in our Washington County communities. And through our CHIP work, we have several different channels through which we invest in those community partners and their work and projects that align with the CHIP goals and priorities. So I'll talk a little bit about those processes and structures now. So first, I'll share a little bit. We have a general structure of how we set up our CHIP work within Washington County is that we have a CHIP leadership team that guides the overall vision of our CHIP, develops the foundational goals, and really leads kind of the big picture road forward as we both set up each of our CHIP plans over the several year period and then implement those plans. And then we have CHIP committees that are more in line with the specific priority areas that have been lifted up within that CHIP. And each of those CHIP committees has a pot of funding that they're able to use to support projects, community-led projects and work that are happening, that is happening in the community that is in line with those committee goals and objectives. So that is one kind of avenue through which we're supporting community work within our CHIP structure. And then the other is our annual CHIP Community Grants Program. And this is another area through which we're investing in our community partners, again, lifting up those projects and I'll say organizational development efforts that they're engaged in to really align their work with those goals and objectives that have been identified within our CHIP. And then we also have, leading and supporting all of that work, county staff capacity is put forth by the county to provide support and implementation for all of our CHIP work. So that includes facilitation of our committee spaces, coordination of leading projects that arise that the various committees decide they want to work on, tracking and evaluating work, etc. So there's a few different avenues through which we're really investing in our partners and the work that is taking place in our communities. And then the last thing I'll mention here is that we also see quite a bit of the work that that kind of starts within our CHIP structure. So it might be like a project that we're funding through our annual community grants program, or a piece of work that one of the committees has taken on and implemented across a year. Then lead into longer term, bigger partnerships. For example, we have about 2 years ago, I believe, we had a community grants project implemented by two partners, Familias en Acción and Adelante Mujeres, focused on community health workers and health literacy. And that then actually was the seed for a much larger initiative that we're now engaged in. We received federal funding from the Office of Minority Health and are now leading a much larger initiative to support community health workers in Washington County and health literacy efforts. So it's been really exciting to see how the work that we start with in our CHIP space often leads to bigger, longer term collaboration with our partners and investment in their work. And I will stop there.
Wow, thank you all so much for sharing. I've learned a lot. Very appreciative that you all are here. Okay, let's go on to the second question. What structures or processes exist to implement your community benefits and investments? And whoever wants to take it away.
I can start. This is Kamisha from Legacy. So the CHENA drives our priorities and our community health improvement plans respond to those needs. So we are currently responding to the needs from the 2019 Quad County CHENA. And so for us, we prioritized addressing or responding to access to care, chronic conditions, and health equity. And so while we know that health equity, of course, isn't separate, we called it out specifically separate in our CHIP just to center our activities for that particular work. And so we have a community benefit advisory committee that supports the development and the resourcing, if you will, the funding of our community health improvement plans. Our system participates in a number of cross-sector groups where we seek to align our investments and strategies, like the mini groups that we participate on with HealthShare. We also have requirements from the state, a minimum spending floor, which requires us to spend a certain amount of community benefits. As I mentioned earlier, a number of things that make up essentially our portfolio. We were the first system this year to have to meet our minimum spending floor, and our spending floor was $252 million for this fiscal year. And then we have a number of tables where we share about the work in progress to kind of keep us accountable, if you will.
So I would say priorities is a very loose word in my world. Priorities change quickly and often. But for our work, we are listening directly to our community partners. So we have a few advisory boards, one that's just community partners and one that's CBOs and local public health. And we are working together to decide what we're going to go ask the legislature for. So on the one hand, we're doing planning now for the next biennium, which is fancy government speak for when we can get money next. The other piece of that, as far as priorities, is in the last month alone, I've been working on extreme heat and the need to get air conditioners out very quickly to Medicaid eligible folks or Medicare eligible folks. The other priority that has, especially this week, taken my life over is monkeypox HMPXV. And so priorities within public health often do shift based on what we're faced with. And what I'm trying to do in our work is that when these priorities shift, we're constantly bringing community along with us to tell us how we need to be doing this work, where we need to be investing our dollars so that we're continually being held accountable by our community partners. So, as I mentioned before, we have several advisory committees. Shameless plug that Uju is one of our amazing advisory board members for the CBO advisory board. And it creates opportunities for us to say, hey, I'm state government. There's a lot of things I cannot do and say, but you community partner have a powerful voice. And if you uplift that voice and use your voice to your policymakers, perhaps more funding and resources could come through. And so I like to encourage our community partners to speak up on that.
So in terms of a structure or a system in place, as I shared at the beginning of, or the first question, we don't necessarily have like a community investment like bucket or fund, right? But now through this new shared initiative and some of the requirements and the structure and even call out to engage, for example, our existing community advisory council, I think we'll be creating pathways and processes to involve not only our community advisory council, but more broadly. I will also say that through our, similar to what Kamisha mentioned, our community health needs assessment then drives, right, our community health improvement plan. And that community health improvement plan is essentially, you know, that needs, I see it as, that needs assessment, we see it as, okay, here's what community mentioned in terms of needs and in terms of support needed. And that community health improvement plan is essentially the response in terms of how is our system going to show up. And so a little bit similar to what Dolly mentioned, we do set of priorities, we call them strategies. There's certain strategies that collectively our 5 plans and our county partners are working on. For example, in the last community health improvement plan, we did a crosswalk across all of the current CHIPs, all the current CHINAs, and identify areas where our CAC directed us to identify areas where there potentially could be gaps or things that we could lift more regionally. So instead of one county just focusing on certain things, was there anything across all of the improvement plans that we as a CCO could acknowledge, could incorporate as part of our health share strategy. And so out of that came access to care. Everybody across all of the hospitals and counties were doing an activity or had a strategy around access to care. And similar around housing. Everybody was doing something around housing. So collectively, we brought that all to HealthShare in terms of our community health improvement plan and identified strategies and work that we could do either to lift that work that was happening in terms of awareness and in terms of other investments. And also to acknowledge like the partnership that was already happening, right? That many of our partners were already on the ground, were already doing a lot of these pieces of work. The other piece that also started developing because we didn't have a second CCO, but now we do, which is Trillium. We're also looking into what does partnership look like? How can we collaborate? And we found a lot of work in alignment and connection around our early life initiatives in terms of supporting a lot of the work that we were doing there. So in essence, also a plug, like more to come around the share initiative and incorporating more community engagement, more community voice, and grateful just for this opportunity for us to come and engage with you all in conversation today. So yes, I'll leave it at that.
Alicia, did you want, I know you talked about this, do you have more to say, or we can go on to the next?
Yes, I was just realizing I jumped ahead and included the second bullet in my answer. I squeezed it all in there. I don't think I have a lot more to add. I think I will just share that we, Washington County, have done quite a bit of work to really look at how we are incorporating the priority areas that have been identified, like my other panelists, my co-panelists shared in the last CHINA, into our current CHIP work. And that's really showed up significantly in how we've prioritized addressing health disparities and lifting up health equity, and really centering, bringing a racial equity lens and trauma-informed care principles into our CHIP structure and work. And I would say that within both like the big picture vision of our CHIP work and then the committees that I mentioned specifically, each of those committees are implementing more specific strategies and projects that align. So as Maria just shared with the access to care, that's one of the committees that we actually have in place. And that committee is specifically focused on improving access to care, including primary care, behavioral health, and oral health services. So our work gets much more specific, and I would say connected to the HCWC CHINA at the individual strategy level as we dig into our specific committees and their priority areas.
Thank you. We'll go ahead and move over to the second set of questions. The second set of questions is all about available opportunities. So number one, what are your community investment priorities for the next 3 years? And if you're able to, please mention, well, y'all have been doing great, CHINAs and CHIPs.
Well, this is Dolly. I feel like I just asked this question or answered this question. Did I answer them wrong?
No.
Okay. Just wanted to make sure. Thank you.
If anyone has anything more.
I can add a little bit more. I think I answered some of this in the last question. So as I mentioned, we're responding to our needs from the 2018 CHINA, and then our new CHINA, as you mentioned, just got produced. And so we're going to be working with our Community Benefit Advisory Committee to determine what needs we will be working on for the next cycle. So I don't know what those next priorities are, just what we're working on now, which is access to care, chronic conditions, and then the health equity. I think for the engagement opportunities, we have six hospitals that span across 5 counties, and our engagement opportunities need to look different, obviously, for our different areas. And so what we're going to be doing is we're going to be hosting quarterly ways that the community can engage with us. And as I mentioned before, I think the most visible is often like our grants, our community health grants. We give those out through multi-year grants, but there's also lots of other ways that we as an organization are supporting community through in-kind or through labs and immunizations that we give to our safety net clinics. So I think engagement can look differently. I think also somebody mentioned about like not overburdening community by asking the same questions and things. So I'm really trying to figure out, what does that look like? I really don't want to bring community together again to do another gallery walk with sticky dots or something. I think there's another way that we can be creative about what engagement can and could look like. So we're going to be doing some quarterly gatherings within our communities closest to our hospitals. And so I think more to come on that, just some learning from each other.
I can also add a little bit more. So within our community health improvement plan, our current one, we run on a 5-year cycle. So our priorities stay for 5 years. And also, it's not like we're going to solve completely all of the barriers that were identified around access to care or food access. So even though those are, we are going to be updating our community health improvement plan as well, since our CHINA has been updated as well. supportive housing, chronic conditions, social connection, those things are still things that are identified as a need and are still needing to continue supporting, right? So that's one piece in terms of our community health improvement plan and our community priorities. Those are those five. So again, access to care, supportive housing, food access, chronic conditions, and social connection. I think now, in case there's not a lot of awareness around the waiver, there are new benefits that are coming our way in terms of having Medicaid pay, for example, for food, to help pay for housing, and to help pay for climate emergency or climate needs. And so those new benefits are also, there's a piece that the Oregon Health Authority has asked for CCOs to engage community-based partners that are on the ground doing this work. And so that's gonna already it's opening a door for for collaboration and partnership. And I hear you, Kamisha, as well, with not wanting to recreate and open new spaces where we tax and we continue asking community-based partners to engage and partner. And again, the opportunity, just like this space, where you're already convening, you're already coming together. I think that's a piece that HealthShare is also wanting to identify, where is there community based organizations that are already on the ground doing this work, coming together, identifying the needs, and how can we support and engage in those conversations rather than recreating another space. And I'm also curious to hear if there's actually a need for opening spaces and creating more partnership or more transparency in terms of us coming to spaces like this. So that is something that I'm very interested in hearing more. The other piece that I will say, so there's new benefits coming, there's new requirements around collaborating with those partners that are addressing food, that are addressing housing, that are addressing climate work, and building partnerships and collaboration. So there's that requirement. We do have also a housing pilot, which we're piloting essentially Medicaid paying for supportive housing, which is an incredible initiative and project that Cristina Casaña, our Director of Housing, is leading and supporting and identifying that framework, which is also engaging community-based partners in that process as well. But yeah, there's always, I think the opportunities are definitely coming, and the requirements that are coming from OHA for all CCOs to open up spaces of transparency, for opening up spaces of collaboration with our community-based partners are definitely here. So through SHARE, through those new benefits, there's also a social emotional health metric that all CCOs are required to engage partners in that connection. And there's also an initiative called Connect Oregon. So in terms of engagement and need to collaborate, there's a lot of work here within HealthShare and within its partners. So I'll leave it at that.
I'll jump in and add a little bit more here as well. So I would echo what other panelists have shared. I think we're at an interesting place to answer this question about priorities for the next 3 years, because we currently are implementing our 2020-2023 CHIP. And then over the course of 2023, we will begin the planning process of developing our next CHIP. So I can't yet speak specifically to what the priorities will be lifted up within that next CHIP cycle, except that it certainly will align with our current 2022 CHINA. But I can share that our current CHIP priorities, so I mentioned one of them is to improve access to healthcare, including primary care, behavioral health, and oral health services. And then others also are to improve behavioral health outcomes, including mental health, suicide, and substance use, and also building systems to improve well-being. That is very broad language and includes chronic disease prevention, food access work, which is a significant body of work that we're focusing on right now, and other pieces of work as well. And then in terms of community engagement opportunities that exist and how community partners can get involved, I would say first and foremost, I mentioned our CHIP committee structure, and that is really, I have been so impressed with the broad representation and partnership within our committee spaces. We just have so many community-based organizations represented there, and we're always looking to bring in more folks as the areas of focus align with their work and interests. So engaging in our CHIP committees, I would say, is one area, an opportunity to engage. Another would be applying for grants through our annual grants program, community grants program, and we generally announce each application process for that community grants program in the beginning of the year. So around January, the announcement goes out. Applications are generally due at the end of February, with grantees being announced in April. So that's an annual process. We're always looking for applications there. And then I would also say that next year, in 2023, we will be planning our next CHIP cycle. And that process will certainly include a lot of opportunities to engage, participate in listening sessions, to provide input and feedback, both through the committee spaces and outside of them as well. So I think we'll have a lot of opportunities for folks to engage and help to direct our work over the next several years in the near future.
Dolly, did you want to add anything?
I was thinking about that, and I continue to think that in my world, taking it to the streets and being loud for the legislature and other elected officials is the most impactful way for community to let leaders know that resources are needed. That's where policy change happens. That's where the money is allocated. That is I think, really concrete way to see that change happen. Now, logically, I'll say we're seeing more programs within the public health division and even within other state agencies express interest in how we are doing grant opportunities for community partners. And I see us partnering with other state agencies. We're already partnering with Oregon Housing and Community Services, and so we're able to shift some resources for housing and rental utility assistance. We're also partnering with Medicaid Right Now to get folks access to air conditioners. I will take any and all random resources that will benefit community and make sure folks know about it. But the long-term systemic funding resources that I think people are really interested in takes organizing and takes going to your policymakers.
Thank you. We kind of mashed both questions in the same section, which is totally fine. I think we can go ahead and move on to open up the floor for a question and answer. Uju or Michael, are there any questions from folks listening in right now? Otherwise, I can go through a few questions that we fielded with registration and whatnot.
Yes, thank you, Jody. And apologies to everyone. I did realize it looks like the chat function is not functioning. So if you have a question or concern, please let us know through the Q&A box. Sincere apologies for that. But we do have one question, which is whom to connect with regarding OHP application. I hear that there's huge difficulties for Slavic and Eastern European communities to understand why the application is so big and difficult. Even native English speakers struggle to fill it out per community-based organizations, how difficult it will be with translation if no one understands the meaning.
I suppose I'm the OHA person on this call, but I do want to note that I work for the Public Health Division, and all of the Medicaid and OHP applications are through a different division. with that being said, we can get you connected if you share your contact info with someone smart on this line who will get it to me, and I will try to support you.
Yes, if this, I know you are anonymous, but if you feel comfortable sending me your email, I can connect you to Dolly. And then the other thing that I wanted to know, it might be helpful to connect with like an OHP applicant assister. So there's a team of folks who are like, their jobs are literally to help folks sign up for OHP across languages as well. And so I can connect you with that team in addition to Dolly. So
That's exactly who I would refer to.
Okay.
So you were on point.
Awesome. So yes, I see your email. Thank you so much. I don't see, if you have questions, feel free to raise your hand or use the Q&A section. I don't see anything right now, so I will turn it over to Joni. We did have some pre-registration questions that we can review.
Yeah, definitely. So one of the questions that we received in the registration is, where do you see the role of SSI or SSD benefits application assistance fitting into the community benefits investments?
This is Dolly. I have zero to do with this. I'd like to preface my response by saying that I believe that training community partners as, for example, community health workers will then allow them to be able to bill Medicaid. And I think there's potential then to look at benefits and resources for Social Security and SSD as well. We've figured out a pathway for Medicaid, and I think over time there's potential to figure out that same pathway for other benefits.
Does anyone want to jump in on that question? Otherwise, I can go ahead and move on to the next. Okay, the next question is, let's see. How would an individual or organization know about funding opportunities? For example, Maria, you've talked about new things coming up, new benefits coming up soon for next year. How would somebody find that information, like how to apply, or what would be like the inroads to getting information so that they could access resources, for example?
So as I shared in the beginning, we don't necessarily essentially at this moment have a process. It's all in development. So I'm happy to come back and share a little bit more information once we have that process in, and share that with you all. So happy to come back once we have more on that.
This is Dolly. I can give a very short answer, which is that the state of Oregon has a platform where all solicitations for funding is posted. It is called Oregon Buys, and I believe Uju will drop the link. Here's what I want to say. Part of my job is to call out all of the inaccessible parts of this platform and how it's not very community friendly and very confusing. And so this is where my team tries to outreach, and I'll say that we really target 501c3s or organizations that have capacity for a fiscal sponsor. We will have trainings, and we've done one recently on Oregon Buys to show folks how to log on to it because it's very confusing. I feel like much of my work is to voice concerns around state policies, procedure, bureaucracy that are not community friendly. And if I'm being honest, that's probably what I'll do over the next 3 years. So Oregon Buys is a great resource that we try to share with our community partners.
I can jump in here and share that for opportunities that exist within Washington County, I would say, again, committee spaces are a great opportunity to learn about what we have upcoming. We always announce our funding opportunities, community grants program when that application process opens. In those spaces, we also have a variety of events. We have an upcoming annual CHIP forum that will be taking place on Friday, September 2nd in the morning. And all of that information we always share on our CHIP website, on the Washington County HHS website. And I don't think I can actually share that link with all attendees, but I can share it with our hosts. So I'm copying it in now. And if someone is able to share it out with attendees, that is also a great place to go to see information about what we have coming up.
I just added it. Thanks, Alicia.
I can go. So our current community health grants have been by invitation to organizations that are in a specific county, serving a specific population and doing specific work. We release our grants once or twice a year, usually multi-year funding aligned with our CHIPs. As I mentioned before, we participate in a number of collaboratives such as HealthShare, such as the Washington County's Access to Care group, which is an amazing group where we've had an opportunity to learn about a lot of other organizations in the space doing, focused work. We also capture a lot of data from organizations that are applying for sponsorships from us. And this has been a good way to learn about other organizations. So our sponsorship applications just online. And we know that sometimes our larger, more senior organizations kind of overshadow our smaller organizations. So the organizations that have been applying for sponsorships, it's given my team a good way to kind of learn about other emerging organizations. And I think that would just be it. So usually right now they've been just by invitation only, multi-year. And then other ways to just kind of get us connected with you is to submit a request to us for sponsorships, smaller dollars, so we can continue to learn more about organizations across our counties.
I'll just go ahead and state the next two questions, which I mean, honestly, have been answered here and there, and I'll go ahead and copy and paste them into the chat box. One is, what did your organization do with the results of the last CHENA? And then the other question was, how can folks build a relationship with your community benefits program or department?
I'll just go first because this is not my area of expertise, and I want to acknowledge that. What my work is one of the implementation strategies of the state health improvement plan. So our state health improvement plan is called Healthier Together Oregon, and I've just dropped that Uju. Somebody else runs and does all of this, but they built this beautiful website, which I'd like to share with you. And also note that the work of the community engagement team is implementing the strategies that are recommended in the state health improvement plan, all of which were developed in partnership with community. So that is my answer for that question.
Go. Let's see. So our CHIPs and the results from our CHIPs from the prior cycle, every prior cycle must be published with our current community health needs assessment. So when we go to produce our next CHNA, post it. We have to report on all the things that we did in that last cycle from the CHIP. So that's one way. We produce our results every 3 years. We have to report yearly to the state based upon our strategies, our funding, and then we also have to report federally yearly. So we also report within our organization to our boards. So there's a lot of different ways at the state, federal level that we're reporting on the implementation of those strategies, and then the resources that supported those strategies.
I can share on this one. Let's see, I would say, I want to find and pull forward a kind of a more specific example of how the results of the HCWC CHINA have showed up in our CHIP work. I would say, looking back to the 2019 CHINA and how that informed our 2020-2023 CHIP, there was in particular a focus within that CHINA of discrimination and racism and trauma as being really the key drivers of all of the core issues that were identified in the 2019 CHINA, and that has really been deeply embedded in our current CHIP, I would say, across all of its kind of structures and levels. So we see that lifted up within our foundational goals, as I shared, bringing a racial equity lens into our CHIP work is one of the foundational goals. And then we've really also implemented that across our CHIP committee work as well. So we've brought in a variety of equity trainings to those spaces to ensure that the work and discussions and projects that are being taken on within the committee spaces are really informed by an equity lens. And it's also been something that we've brought in as we think about developing metrics to guide our committee work and our CHIP strategies as they move forward.
Yeah, so as I shared earlier, our last CHINA definitely feeds into our community health improvement plan, or the development of the community health improvement plan. And we do plan to kind of refresh our current CHINA because that's it needs to be updated based on the new regional needs assessment, and we will do that. We have new CCO requirements to do that very collectively with not only the other coordinated care organization, Trillium, but also within our hospitals and counties. And we do that very well within HCWC to develop the regional needs assessment, but now it's also asking similar engagement and collaboration to create our community health improvement plan. So that those are some ways of us using the results from our last community health needs assessment. And then in building relationship, one of the things that we did when we developed the last CHIP is we also recognized that we could miss communities that were not engaged in that last community needs assessment. And so based on that, the RCAC helped us identify communities and voices where there was no representation in our community health needs assessment. And so we identified kind of those gaps, and we went out and did other listening sessions, in particular with those populations in mind. And so that is an opportunity for sure for engagement and collaboration. And as I shared earlier, there's many new opportunities that are coming our way. And I think we're trying to identify what is the best way to share the information, not only within our partners, but also with those with our partners, most importantly, because they're working very closely with community-based partners, such as Alicia shared and Kamisha with hosting different spaces, but also trying to identify opportunities to broaden that message and share more opportunities more broadly. So hopefully coming back to spaces like this, and happy to share my information if you are interested in connecting and learning more about our Community Advisory Council, for example. Yeah, happy to share that information as well.
Thank you all so much. We're going to go ahead and take it over to the audience question Q&A. Uju or Michael, are there questions that have popped up?
There sure are. There are 3 questions, and I will read them each aloud. The first one is from Amy. Many people who need in-home care cannot get in because they cannot get Medicaid. Or if they do qualify for Medicaid and in-home care under Medicaid, few people are willing to provide the needed care. Are there any grants to help individuals in these situations?
I don't know. Full transparency. Yes, once they land here at Hellshire, they have Medicaid. I don't know the home care.
Yeah, I've been in a similar situation, actually trying to assist a pastor within my faith community, and he was over income for Medicaid, and they wanted him to spend down all of what he had in savings before he could then be eligible and access the care. And this, I think, is an example of where the system is broken. And we don't have the right resources to support. And it's unfortunate. And oftentimes in these types of situations, I recommend to an individual or a community, like, are there faith communities or other outside groups that you might be able to reach out to, because the systems to which we work within right now don't support that need. And if they do, I'm not aware of it.
Uju, do you want me to read the next question?
Yes, I was just waiting to see if anyone had any other thoughts
Oh.
around that question.
I'm not a panelist, but I will say that one of the things here is that, most of the community benefit investments initiatives are really aimed at kind of community level funding, and those kind of individual grants for individuals, are probably, maybe a purview of some of the smaller organizations that get funding to provide services. So maybe 211 might be a place to call to see if they know of any resources for individuals. The next question is from an anonymous attendee. It is, what if a CBO had a new idea to support community, like housing assistance? How could they get help from you all?
I can jump in here. I would say, as I mentioned, please, we welcome applications for our community grants program. We would love to see any and all projects proposals that are submitted. And I think that also acts as I think when people think of Washington County, any county, there are so many different programs and so many different doors that you can walk through. And so we might have partnerships and contracts with a community-based organization in one division or team, and another one in another division and team. So there's a lot of different ways that you can partner with us. And we are very intentional about identifying other potential funding streams that may fit for an idea, a project proposal that we receive. So even if we're not able to fund something through our CHIP community grants program, for example, I can think of several occasions historically where we have then been able to connect that that proposal with a different funding stream that is able to support that work long term. So I think reaching out and connecting with us is a great starting place, and we're always happy to then find whatever avenues might exist to put forth some funding.
This is Dolly. I just shared a link with Uju. The state actually has an agency specifically for housing, Oregon Housing and Community Services. I would check out their website. I know that they also have funding opportunities and fund community partners directly. So I'd encourage that as another place at the state level to check out a resource.
And then if no one else has any responses to that question, the last question we have so far, and we do have about 5 more minutes, just so folks know. How can people know what is done with the CHINA over the years? Is there a website or a monthly meeting?
I can start. Well, just for our system and other health systems, we are required to post our community health needs assessments online. So they're online and then their results from the last 3 years for the implementation of our CHIPS is there. I think there is continued discussion about within our systems and partners about how do we, work together on implementation strategies. And I would think that would also be about like what we've done. And so I think we've had little kind of snippets about what we've done collectively. I think there was a video before kind of talking about like what all of our systems had done, but legally for our, at least the health systems, we have to post our CHNA, and then those CHIPS and what we did the prior 3 years are in there. And then the reports from the state are online as well within the narrative, but it's probably, at least for us, a little bit more accessible to go to our page and look at our community health needs assessments and see what we've done at least the past 3 years.
I would say for us, or for all CCOs, we are required to also submit progress reports where we mention what we did with our community health needs assessment, but also more on the progress made through the community health improvement plan, which talks more of the strategies and like action after the CHINA. So that's where you will find, and all of the reports are public, and I will try to find the website so you can see that as well. And we do have public, at least twice a year, we try to have a public, or community advisory host a public meeting. So I'm happy to share once we have some of those dates with OHE so that they can share it with the collective here. And then the other piece is we do have an upcoming event in September as well, where HWC partners are going to be presenting and talking a little bit more about further engagement through HWC in that partnership. So happy to share that information as well once it's available.
I'll just quickly add both the website that I shared and reviewing the information about our CHIP work that is posted there would be one avenue, and another would be, I mentioned also our annual CHIP forum, which is coming up in just 3 weeks on September 2nd, and joining that event would be another great opportunity to learn about the work that's been done.
Thank you. Any other questions? Feel free to raise your hand or use the Q&A. We have about 2 minutes left. I feel like playing jazz music as we wait.
There is not another cute question in the thing, but there is a little chat. Tina says thank you to everyone, but couldn't do that in the chat. So thank you, Tina.
Oh, thank you, Tina. Okay, well, I'll pass it back to Joni to close us out with the panel.
Am I unmuted? Here we go. Well, thank you all so very much for coming and participating and sharing all of your knowledge and expertise. I definitely learned a lot, and for a community action team member that was working on the CHINA, it would have been so great to have known all of this from the get-go, because there are a lot of questions. So this was very, very helpful. This was a really great panel. Thank you so much for coming and participating and supporting the work. Uju, I was gonna pass it back to you to finish closing.
For sure. We'll reiterate, thank you, everyone. Thank you to our panelists, to Joni for facilitating this awesome conversation, to our interpreters, captioners, Michael on tech. Just thank everyone for being here and being present and engaged. We are sincerely hoping that you're living here with some gems, ideas, dreams, maybe some new connections as to how to better support community. So for closing, I'm gonna drop a link in the chat box to a survey. This is the third of our series, and we're always improving and learning. Like, for example, there was no chat today. Why was that? So we're always learning and improving. So if you have any feedback for us, please, 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 please feel free to fill out that survey. I will review that, and for the next series, use any information or questions. This conversation actually stemmed from a question from our last event. So please know that we, like, any question you have, please feel free to send it our way. And then other things to know is that we will continue this series. So you have your emails, you will receive future events and notifications. And if you want to learn more about OHEI or become a part of OHEI, I will drop my link in the chat, not my link, excuse me, my email in the chat box, and we can connect there. But that's it, folks. Thank you so much, everyone. Again, I will send out the recording via email when it's ready, and all the links that were shared as well. Thank you, everyone. Have a good evening.
Thank you.
Thank you. Bye.
Thank you all. Joni, great job. Kudos.
You
to
did great. Yeah.
Amazing.
Oh, thank you for all the support. I definitely was not seeing your chats, and I was like, oh no. But then I was like, oh, I think the time actually worked out okay.
It was perfect. It was, no, you don't need to worry about it. All right.
All right. Is there anything that we want that we, I don't know, want to debrief on, or are we good?
If you don't have anything, then I will let everyone, I always stick around because I never know what people have to talk about. But yeah, I think you did a great job. Thank you so much, Michael, as well. Yeah, this is great.
Thank you
Yeah,
all.
thank
I'm
you.
gonna sign off then.
Thank you. Bye. I'll
Bye.
touch base with you later, Uju. Okay,
Yes.
bye.
Thank you, DeAndre. Thank you, Leticia.
Fine. I wanted to stay last because I got to interpret everything.
Yeah.
Have a nice day.
You too.